Welcome to the MF1 Clinical Skills Preceptor Orientation. So my name is Dr. Jason Profetto. I am the chair of Clinical Skills at McMaster University. And today we are going to be doing a brief orientation for Medical Foundation 1 Clinical Skills Teaching. So if you are listening to this, you should be a co-resident preceptor selected by the program for Clinical Skills in MF1. And what we're going to do is I want to go through briefly just some things about Medical Foundation 1, what clinical skills is, and some of what I think is the more prudent details around the orientation. So Medical Foundation 1 is actually the first medical foundation, the first unit for the medical students that are incoming. Clinical skills is one of the three major parts of the pre-clerkship curriculum, right? So we have the professional competencies, which is more ethics, professionalism, and related topics. We have the actual tutorials, which are the twice per week sessions that they learn about the more content-focused aspects of medicine, respirology, and cardiology. And then clinical skills. And clinical skills is the big piece where we teach students and allow them to practice with observation on how to do histories, physical examinations, and some of the diagnostic conversations as well, diagnostic testing. So clinical skills is a big part of the medical foundations. We want to thank you for your interest, commitment to teaching. I see that many of our teachers for clinical skills are obviously past medical students, but many of them are from McMaster and the surrounding areas as well, which is always really fun. And we try to give everyone an opportunity to teach because there's a lot of residents that are interested in teaching. So you were selected as a part of a balanced process in preceptor selection. So a big thank you again for your commitment and willingness to teach. That's sort of the brief introduction, and we will get into it. So Medical Foundation 1 is one of 5 medical foundations. Medical Foundations 1, 2, 3, 4, and the last is the Integration Foundation. Medical Foundation 1 is going to be focused on 3 major subunits. The Introduction to Medicine. Because remember, not only are these first-year medical students, this is literally their first unit, respirology, and then cardiology. This is MedPortal, and MedPortal is the sort of main hub where you're going to get all the information, medical students and preceptors alike. And Medical Foundation 1 is also where they have their first introduction to McMaster. Now, it's important saying that because generally speaking, the clinical skills preceptors tend to be some very critical, important role models for the students. And it's a great privilege. It's a great opportunity to model some of the important behaviors on what we should and should not do, and giving some of the students some encouragement and guidance, as right now it's a very nerve-wracking time coming into medicine, especially these days with the pandemic and all the virtual adaptations. So clinical skills is, you can see like these are the actual documents for the students. What we're going to be using is the clinical skills guide. And perhaps what I'll do is I'll first start with this agenda document. So actually, no, pardon me. I meant to start with the entire document. So this is the clinical skills guide. The clinical skills guide is basically the organized curriculum for the clinical skills in MF1 to the Integration Foundation. Everything is organized here. There's all sorts of stuff about what we do, the how things are related to the OSCE, to clerkship, stethopedia. So there's a whole whack of stuff. I'm going to go through it shortly. But it's also important just to get an understanding of the basic structure of clinical skills. Clinical skills is a weekly session that happens that lasts approximately 2 to 3 hours, and it's organized by the program. Students are divided into groups called tutorial groups. The tutorial group is usually 6 to 8 students depending on the details. And generally what happens is that this group will stay together for the entire first medical foundation. The medical foundation will go week to week, and there will be all the mandatory components involved. And for clinical skills, it will follow the weekly session guide. You can see that MF1 is 10 weeks in total, with all the specific details that map to the subunits in MF1. Each group of 6 to 8 students is assigned 2 resident co-preceptors. That's you guys. And you will together teach clinical skills. Now, part of the structure that's different than usual is that this is still going to be virtual. You have to appreciate that although at the very moment in Ontario, lockdowns and restrictions are much more lax than they were before, we were planning this at a time when we were not able to provide an immersive in-person experience. MF2, which is going to begin in the fall, more towards the end of September, early October, will indeed be in person. So your sessions will be virtual as organized by the program. The obvious question is whether or not students and groups and preceptors are allowed to meet in person. Because technically within the province right now, and as per the public health guidelines, you actually are allowed to meet in person with smaller groups. So meeting up with your preceptors, your groups in an actual clinic environment, outside somewhere, or somewhere that is safe and you can talk and do clinical skills, it is technically allowed and is not necessarily discouraged by the program. The program, however, cannot formally organize in-person sessions at the university at the moment. So we're not allowed to do that because of restrictions in the university not just opening yet. In the fall, it's going to be a little bit different, but in the meantime, you can do your sessions virtual or in person. Noting that, it's incredibly important to make sure that whatever you do, if you're doing things in person or meeting up or whatever, you cannot exclude people. So if, for example, not everyone in your group is able to meet in person, you should definitely do the session virtually. Have a discussion with the group, see where everyone's comfort lies, and come to a negotiation, come to an understanding of what would be best, and maybe start with the first few weeks virtual and then go from there and see how people are doing. You'll see too that for some of these sessions, you'll actually have virtual standardized patients booked for you, and they will be available by Zoom, especially for the more like history intensive components of these sessions. It's important to note that while we aren't necessarily organizing at the university in-person sessions for MF1, we are going to have workshops right at the beginning of MF2, the end of MF1, where students will be coming in person for a prolonged in-person session where they can practice, receive observation from preceptors and receive feedback as well. You'll see that the session guides here are organized in a specific way. So the first chunk is going to be introductory, right? So understanding what clinical skills is, the concept of history taking, also how to establish an effective physician-patient communication or rapport. Also some practice, so history practice and integrating these concepts, and then the introduction to the physical exam and vital signs. So that's the first 4 weeks. After that, you're going to have 3 examinations that you're going to have an introduction to, and then the subsequent week will be a practice. So the first one's going to be the respiratory exam. The second will be the respiratory exam practice. The second content is going to be the cardiac exam, followed by the cardiac exam practice. And the last is going to be the introduction to the head and neck, less the lymph node exam, and then head and neck practice. Now, you're obviously not going to have an ideal solution per se where you're meeting with people in a hospital or a clinic and practicing on actual standardized patients, but you will have an opportunity to do all of this virtually and or in person if the group decides to indeed meet. I realize there's some vagueness here, and we can help clarify if groups have any require any clarification. But the standard will be that you're going to be meeting every single week, likely virtually, and you're going to have SP cases that are going to be dedicated to you as well. You have to be creative. You have to use your resources and all of the session guides to understand what you're supposed to be doing. It's also important to note that at McMaster, we also really try to integrate principles of diversity and inclusion as we're teaching clinical skills. You'll see there's a lot of professional competency connections. And what we try to do here is explicitly integrate aspects of E, D, and I as it pertains to teaching clinical skills. So for example, when we're doing the physical examination of vital signs, having a discussion on patients of varying body habitus, especially individuals who have elevated BMIs, or experience obesity. Because what's going to happen when you're doing physical examinations, there might be alterations or adaptations that need to be made for individuals of varying body types. We also talk about some occupational health, especially as it pertains to things like COPD, dyspnea, cough, smoking, etc. And we also talk about individuals that are socioeconomically disadvantaged or vulnerable, as well as poverty. So, and as these pertain to the different examinations that we do. The point of ProComp Connections is not to hijack a session and to completely divert it, but to integrate it in an effective, efficient manner in which it's explicitly covered and mentioned so that students and preceptors are constantly reminded of the very important concepts relating to diversity and inclusion in everyday life. And one of the simplest examples I often like to use, and this is one of my very first interactions with this, is I had a patient with Parkinson's and I had to do an abdominal exam, and he was physically unable, was not able to safely come onto an examination bed. So I had to do an abdominal exam while he was sitting in a chair. So that's an individual that has a specific medical issue and disability that I'm going to have to adapt in order to do an actual abdominal exam. And these are sorts of things that are transferable and transcend different parts of medicine, and we need to start thinking about them early on. So when you go up here, this is the MF1 clinical skills content. So this is the actual overview, right? And you'll see that there's a respiratory exam, the cardiac and hematological exams, the head and neck, and the peripheral vascular. So this is the stuff that's actually going to be covered within your session guides. But this is the actual content. So if you click on it, for example, it'll bring you to a very immersive sort of guide with all of the details that you and students have an opportunity to review. And a lot of students will use this as a way to sort of prepare and come to clinical skills. Also, when you go to these guides, if you go to the weekly sessions, you'll see that it's MF1 session 1, the introduction, the global objective, which is fairly straightforward, and then also what is expected to happen. We always say, doing a bit of a briefing before, making sure that students are on the same page as you, everyone's prepared, and also at the end, feedback. How did the session go? What's worked well? Where can we improve? What do we want to do next time? And what do we want to alter, right? And if you go from session to session, you'll see all the different things. You'll see when you have a standardized patient to practice which will be organized for you with the program, and the different ProComp connections, with a little bit of background reading as well, just so people are up to date and they have actual references and reading that's available for this, right? And this goes on to all the additional. See, the occupational health one, talking about occupational health, exposure risks. Yeah, see, this is more like with respiratory, smoking, asbestos, for example, asbestosis, mesothelioma, etc. So just getting introduction to these different topics. If you go to this abbreviated document here, this is the agenda, which shows the things that are going to happen in clinical skills. Now, and see here too, clinical skills, so some very brief descriptions in terms of what happens in clinical skills sessions and how long they are. So 2 to 3 hours every week. It's going to be in a small group, co-resident preceptors. MF1 will be mainly virtual. There is the AFMC National Clinical Skills document, and basically this is the national standard that was developed by all the chairs across the country about what's expected more or less at the different levels. And you can go to this, and it's actually a pretty interesting document. And you can go to understanding central cyanosis and what the evidence is and what level is expected. And you can go into this a little bit. Most people like to know that it's available for an actual reference. But just also to remind you and to show you that this is where we get certain standards on what should be taught at different stages, right? So feedback is very, very important. We always recommend ongoing feedback and observation, communicating with the students, advising them on what they're doing. It's really important to note that in clinical skills, we teach and practice. Students have to have ample opportunity to perform histories, physical examinations under the guise of their the guidance of their actual preceptors, to get observed, to see if they're meeting expectations, to receive feedback on areas to improve. There will be a mid and end unit evaluation. So the mid-unit evaluation will be prompted to the preceptors via email, and same with the end of unit evaluation. And this is where you give students a bit of an update in terms of where they stand and how they're doing and where they can improve. That should not be the first time that you communicate with the students. In terms of feedback, evaluation, and observation, that should be happening every session, all the time, on a regular basis. So when you reach your mid and end of unit evaluations, it's very clear and students are expecting that sort of feedback. So Stethopedia is a fantastic resource that is McMaster driven and created. There's a Stethopedia website. This is fully McMaster based. And this is the clinical skills videos from our clinical skills reps and staff. And basically what we have available here is all the physical exams in terms of what you can do, seeing it in an OSCE style, special test. And just to show you, for example, let's go to the cardiac exam. There's an actual video. This is done by our students. It's beautiful. It's amazing content. And there's all sorts of like different visual things. That's really cool.
I'm working with Dr. Perfetto today. Is it okay if we do a cardiac exam?
So Stethopedia, I'll just pause that. You can go through all of these and get a sense of what's happening. We have some up and coming. I'm supposed to do the dermatology one soon as well. And peripheral vascular thyroid, etc., etc. So it's really good. There's even a radiology piece here where they go through different things about the approach to chest x-rays and varying radiological investigations. And let me just go back here. So if you go back, the guide is a very comprehensive guide. It shows how what we do for first year students and how things are organized. It talks about what we expect in terms of preparing for the OSCE with the OSCE tips and all of the actual sessions. We've talked about the Stethopedia. We've talked about the AFMC. These are all the contributors to the actual guide over the years. And then again, we get to the session guide, some additional information that's available too, and the content. So what I want to do then is maybe I wanted to keep this somewhat brief so it was easy to get through. If you ever have any questions, you can very easily send me an email. I'm happy to chat. This is me over here, the chair of clinical skills, and MF1 starting soon. These are students that are super excited. We know as a fact that MF1 tends to be one of the most exciting and nerve-wracking times for these students. So you're going to have a really, really big impact on their first exposure and experience in clinical skills for early medical students. Thank you very, very much for your time. I am happy to answer any questions. If you go through the guides, you'll get a lot of the detail that you need. And if there's anything else remaining, please let me know. Thank you very much. Best of luck, and we'll talk soon.